doctor. This is Efrain Colazo to do the shoulder maneuvers videos. I have Marlene in here. I have Alondra. She's helping me recording the videos. Well, I'm gonna show different techniques using the examination of the shoulder, and I will divide it in the different categories of shoulder injuries. The first ones are focused on shoulder instability. Okay, so after reviewing different articles, I think that the best option to do shoulder instability testing is the apprehension test and then the surprise test. So first one, for the apprehension test, the first thing is this test is used to see if there's anterior glenohumeral instability. So in this case, I'm doing the test in her right shoulder. So my left hand will be on her wrist, and then my right hand will be on the elbows. The position of the shoulder will be at 90 degrees of abduction and 90 degrees of external rotation with 90 degrees of elbow flexion. So what we're gonna do here is trying to do full external rotation, and that should reproduce some pain, some clicking, or there should be some instability. At the same time, the patient can stop the process because it's creating the instability. And for at the same time, we can do the surprise test. This one is basically the same motion that we do in the apprehension test, but in here, what we are doing is the same thing, and then I use my right shoulder to press the humerus in the glenoid fossa, and while I'm doing stability in the shoulder, once I take out my hand, then because I retire the stability with my hand, then the humerus will have that displacement, and we will see again the positive instability or pain at the shoulder. Well, on this occasion, we're going to move to do examinations of the labrum in the shoulder. After reviewing different articles and the literature, the first one that I would pick is the passive compression test. In this case, we are trying to do a compression to see if there's some symptoms related to labral tears or labral injuries. Okay, so for the passive compression test, the patient would be sidelined at the side. In this case, I'm working in her left shoulder. Then I'm working in the left shoulder. My left hand will be on her elbow, and my right hand will be on the acromioclavicular joint, do stabilization. And what we are going to do is first we're going to put the arm in 30 degrees of abduction, and then after doing that, I will do superior compression with external rotation, and at the same time I'm going to do extension of the shoulder. That would make a compression to the lateral part of the shoulder, and then the test will be positive if we heard a click or pain in the area. The second test that we're going to do for labral injuries is the passive distraction test. That's the second one that I'm going to pick for evaluating labral injuries. In this case, the patient will be supine. We're going to possibly put the arm in 150 degrees of elevation, and the patient the forearm should be in a supinated position. So in this case, I'm going to grab with my left, in this case I'm working the right shoulder, I'm going to grab her wrist, and with my right hand I'm going to grab the elbow. So what we are going to do in here is in 150 degrees, we're going to do a rotation to move it to pronated position of the forearm. And then if the test is positive, we should reproduce internal pain of the shoulder. It could be anteriorly or posteriorly, and that would recreate the symptoms, so that would be a positive test. Now we're going to move to evaluate some rotator cuff injuries or rotator cuff tears. The first one that I'm going to choose is the external rotation lag sign. After reviewing in the modules and in the literature, I really believe that this one is going to be a good test for examination of the rotator cuff. In this case, when we're doing the external rotation lag sign, the patient should be standing. We're gonna have 90 degrees of elbow flexion, and then we're gonna passively move the shoulder to a slight external rotation. And what we're gonna try to look in here is if the patient can hold the position of the shoulder in this position. Okay, so you're gonna maintain your shoulder and elbow in this position. Don't let drop. So if the patient can hold that position, there should be less probability to have full thickness of the infraspinatus or the supraspinatus. In the case that the patient can hold this position and her arm drop right down to the belly or down, there should be a probability that we have full thickness or some injury to the infraspinatus and supraspinatus. Continuing with the rotator cuff, in this case, we're gonna access singly the supraspinatus. And for assessing the supraspinatus, I pick the lateral jog test. In this case, we are trying to assess if the supraspinatus have some injuries or not. And for doing this test, we are gonna position the shoulder in 90 degrees of abduction with internal rotation, and then it is important that the patient, her fingers should point down and her thumb should be pointing medially. So what are we trying to do here is assess if the patient can first, if can hold this position. If the patient can't hold this position, then there's obviously some problem with her supraspinatus. After doing this, if the patient is able to hold this position, then we're going to assess if she can be strong, she can hold that force. So you could do it in here. I prefer to go at her back, at the side, trying to stabilize the shoulder, and then I'm gonna do a downward force. And the patient should hold my force. It's 1, 2, 3. Yeah. Patient should hold that position. If not, it's positive if the patient reports some pain, or if I notice that there's some weakness. And analyzing that with my history, I can verify or I can access if there's tendinopathy or an injury to the supraspinatus. In this one, I'm gonna access the teres minor muscle, and I picked the Hornblower test. For the Hornblower test, we have two different ways, or there's two parts that we can do to access the teres minor. The first one, we are going to position 90 degrees of abduction of the shoulder, and then a slight horizontal abduction, and then I will ask, and 90 degrees of elbow flexion, and then I will ask the patient to hold this position. If the patient is able to hold this position, there should be no rupture or full thickness of injury to the teres minor. If I want to assess a little bit more of strength, then I would do the same. I would instruct the patient to maintain that position while I do a downward force. And then I can assess the strength of the teres minor. The second one is moving a little bit here. Then we do a little bit of horizontal abduction, elbow at 90 degrees, abduction of the shoulder at 90 degrees, and then it's the same thing. We're going to first assess if the patient can hold this position. If she can hold this position, there should not be any serious injury or full thickness rupture of the muscle. And then if I want to access the strength, I would do the same that I did in the first part. So I would instruct her to hold this position while I do the force to moving it to internal rotation, and in here I could access the strength of the muscle. Now we're going to move to what it should be, or if I do an examination of subacromial impingement. after reviewing the literature and the module, there's no good reports on specificity on testing for shoulder impingement, but I would pick two. I think they are the best options for assessing. Obviously, having this examination and comparing it with all the things that I evaluate in my history and my examination. And the first one is going to be the Hawkinson-Kennedy test. So in the Hawkinson-Kennedy test, we are looking for the presence of symptoms related to subacromial impingement. And for the Hawkinson-Kennedy test, what we're going to do is we're going to position the shoulder in 90 degrees of flexion, elbow in 90 degrees of flexion, and then I would do a passive and full internal rotation that should reproduce the compression of the area. And then is positive if the patient reports some pain. I have another option in here. If the patient is larger than me, or if I want to stabilize more the shoulder, then I could do, you're not gonna see my face, but here I would stabilize the shoulder, and then I can control her motion, and then in here I would do a more force in passive internal rotation that should reproduce pain if the patient have the condition or the injury. So this one is used to verify the possibility of the existence of shoulder, subacromial shoulder impingement, and this one is the Hawkinson-Kennedy. Now the second one for assessing subacromial impingement is going to be the Neer's test. For the Neer's test, I would position at her side and at her back. In this case, I'm working on her right shoulder, so I'm gonna use my left hand to stabilize the scapula. And then we're gonna do a passive complete shoulder flexion, passive shoulder flexion with complete internal rotation. And then when I do that, that should reproduce some pain if the patient is positive. That pain could assess some involvement of the supraspinatus, the long head of the bicep, or the subacromial bursa. Okay, so this is the Neer test for assessing the possibility or presence of an injury related to subacromial impingement. Okay, the last testing that I'm going to show you is the active compression test of the Orion test. I would pick this one for AC joint injury, but at the same time, the literature have reviewed that we can use it also for assessing the labrum. Okay, so for the active compression test, we're gonna have 90 degrees of flexion and 10 degrees or 15 degrees of horizontal adduction. And the first step, we're gonna do a complete internal rotation. Here I'm gonna put my left hand in her shoulder, and then I'm gonna instruct her to do elevation of the shoulder while I do resistance, okay? So I access here, and then I do the same, then I move to external rotation, and then I instruct her again to resist, to elevate the shoulder, so I do resistance, okay? The first thing is that it's positive if there's some more pain in the internal rotation than in the external rotation. That's the first step. Once we can be sure about this, that the patient reported that she felt more pain in internal rotation than external rotation, then if the pain was reproduced in the inside part of the shoulder, we could think that there should be an involvement of the labrum, an injury to the labrum, or if she stated that there's more pain at the top of the shoulder, at the acromioclavicular joint, then we will say that there should be an injury to the acromioclavicular joint. And that would be my cluster of testing. Thank you.